Good afternoon and welcome to today's COVID-19 update. I'm Heather Fairbairn and I'll be your moderator today. Before we begin, allow me to introduce the Honourable Iain Rankin, Premier of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Take it away, Premier.
Thank you, Heather, and welcome everyone. I want to start today by acknowledging that we did have, unfortunately, another death due to COVID, a Nova Scotian in their 50s. So I want to extend my condolences to the families impacted by this tragic loss. Someone in their 50s is far too young to lose their life. We are reporting 40 new cases today, 29 of those cases in the HRM area. So again, the majority of cases in Central. Lower cases in the Eastern Zone today, but I will note that yesterday the cases in the Eastern Zone, specifically Sydney, were higher than the Central Zone. So the two areas of concern remain to be in the Halifax area and Sydney. And that was fully considered when we looked at how we're going to start to slowly open back up. And of course, we'll speak to that in just a moment. But I do want to thank Nova Scotians. This is a big day. It's in large part because of the hard work of all Nova Scotians for listening to public health protocols, for going out and getting tested regularly, for getting your vaccination when it was due. This wave is being crushed in almost record time when you look at what's happening across the country. How? Because we locked down quickly and decisively. We put in the strictest measures in any jurisdiction. Why? Because of the sacrifices of Nova Scotians who respected the protocols and answered our calls to get tested and embraced our vaccination program. We are ahead of schedule on our vaccine rollout. On Tuesday, we dropped the eligibility to 20 and up, and yesterday, just 2 days later, we dropped it to 12 and up. So all those ages that are approved for the vaccine are now able to get their vaccine. Now we have 53% of Nova Scotians with one dose of vaccine, at least one dose, and 68% of Nova Scotians either have that dose or are booked for their first dose. It's a record week for vaccines, 82,000. And we had a record day on Wednesday when we administered over 21,000 doses. And most importantly of all, I think, is that our hospitalizations are decreasing. This is a positive sign, and this is the science, and this is the data that gives Dr. Strang and I the confidence to announce today our reopening plan. Je remercie tous les gens de la Nouvelle-Écosse d'avoir fait ce qu'il faut pour rendre ici. Nous avons combattu cette troisième vague en un temps record, plus rapidement que les autres provinces. Comment? Nous avons confiné la province rapidement et de manière décisive. Nous avons mis en place les mesures les plus strictes au pays. Pourquoi? En raison des sacrifices des gens de Nouvelle-Écosse qui ont respecté les protocoles de santé publique, qui ont répondu à l'appel quand on leur a demandé de se faire tester, et qui ont accueilli à bras ouverts notre programme de vaccination. Le plan de vaccination avance plus rapide que prévu. Mardi, nous avons offert le vaccin aux personnes de 20 ans et plus. Hier, seulement 2 jours plus tard, nous avons été en mesure de l'offrir aux gens de 12 ans et plus. Et nous nous préparons maintenant à administrer les deuxièmes doses. Il s'agit d'une semaine record. 82 000 doses. Rendez-vous ont été pris pour recevoir le vaccin cette semaine. Et un nombre record de vaccins ont été administrés mercredi, soit le plus de 21 000. Mais surtout, le nombre de personnes hospitalisées continue de diminuer. Il s'agit d'un signe positif. Il s'agit de la science et des données qui nous permettent, au Dr. Strang et moi-même, d'annoncer aujourd'hui notre plan de déconfinement. What Dr. Strang and I are announcing today is a Nova Scotia success story, a 5-phase plan for reopening that is a result of the quick action and sacrifice. It is based on data and not dates. It is a strategy informed by the consultations that the ministers and I, a lot of public servants, Dr. Strang and his public health team conducted over the past several weeks. We met with small businesses from the real estate sector to restaurants to salons to gyms and more, health experts, consulted with tourism operators, And what we heard a lot was they wanted to see some predictability of a plan, recognizing that they understand our epidemiology does change from time to time. And we heard appreciation for the need to stay the course. Our strategy allows for a reopening that is gradual and cautious and watches the epidemiology. It's focused and it's flexible. And Dr. Strang will give some more details of the strategy, but I just want to go over some elements of the plan, just broad strokes. It is, to start off very cautiously, as I said, we're going to be looking at how we can accommodate more activity in our businesses and in social gatherings, but it is looking at where the lowest risk areas are, of course, outside, where transmission has been limited and very low risk, and looking at the other areas of low risk inside businesses, so retail, for example. Just looking at restaurants, so I'll highlight how that is for an example. As we start in phase 1, we know that restaurant and tourism, restaurant and bar sector, has been impacted significantly. But we also know that they have outdoor accommodations with patios. So on June 2nd, that's next Wednesday, we're going to provide certain requirements. If they can open and stay within the requirements of maintaining 6 feet between groups, we're accommodating a patio opening, and that will allow for a maximum of 10 people per table. By phase 2, restaurants will be able to get open their indoor dining and have those same requirements in place. So each of our phases have about a general time frame of 2 to 4 weeks, maintaining that flexibility. This is just an approximate timing on when we would move from phase to phase. Phase 3 would be, again, approximately 2 to 4 weeks after. We would increase the hours of service that they're able to operate. And then by phase 4, which is likely getting close to middle to late July, and if case numbers and hospitalizations stay down, they would be able to open back up to what regular hours look like. So that's one example, and we're going to provide more details. And as I said, Dr. Strang will go over more of those. I did want to speak to schools. So we made the decision when we saw significantly increasing cases just a couple of weeks ago that we would keep to the online learning model that has been relatively successful across the province. Today we see very low activity of COVID in the areas outside of Halifax and Sydney in our province. And I know that kids want to be back in school learning with their teachers. It was always our plan to the extent possible, keep kids in school where they should be if it was safe to do so. With advice from public health, it is safe to do so. We want kids to be back in their classroom, reconnecting with friends and having the opportunity to end the school year on a positive note. So the decision was based on advice from public health, pediatricians at the IWK Health Centre. And so in consultation with the province, we are going to continue to reassess in-person classrooms for HRM and Sydney students. But today we're making the decision that we will open schools outside of Halifax and Sydney. So it'll be in-class learning will resume for those students that are outside of Halifax and outside of Sydney. We want to continue to make sure that we're keeping the best interests of public safety first, but our experts have told us that in-classroom learning is so important, even if it's just for 2 to 3 weeks. And so if we have the opportunity to make lives better, we will do that in a heartbeat. We also have to pay special attention to those that need supports in the classroom. So we are accommodating those with diverse needs in the Halifax and Sydney area. They will also be able to go back into the classroom environment. So I wanted to give those few details, which Dr. Strang will go over more. It's a comprehensive 5-phase plan. I want to reiterate that testing is extremely important throughout all phases and beyond, that we continue to get tested. And there are certain milestones with each phase that I know Nova Scotians will work hard to achieve, so that we can continue into each phase, so we can open up more businesses, and that's so we can ultimately get to see more of our family and friends across the province. I'll turn it over to Dr. Strang.
Thank you, Premier. Good afternoon, everyone. And like the Premier, my thoughts and prayers go to the family and loved ones who are grieving today about another death due to COVID. This is a clear reminder that this virus is serious and needs to be taken seriously, and that public health measures and restrictions have been and remain necessary. And while this is incredibly difficult news, I am encouraged by our progress in slowing the spread of the COVID virus. Cases are declining, vaccinations are increasing, and we're talking about reopening. But COVID isn't gone, and we are hopeful, about our way forward. And I want to thank everyone for your hard work that has gotten us to this point. While I'm encouraged by our numbers, we still have some community spread in the Halifax area. And so far in Sydney, there is some spread, but it's been mostly focused in a very specific area and in an age group with little impact on the general community. People do need to keep getting tested, especially in the Sydney and Halifax areas. There are many options available, and we do have our mobile van this weekend in Sydney and in New Waterford. So please book a test if you have mild symptoms or have been identified as a close contact by public health or have been at an exposure site. And through these, you need to book for a PA through one of the primary assessment centers. In general, if you're just out and about at all, then you need to keep getting tested. And you can do that either through asymptomatic testing through a PAC or one of our pop-up sites. Testing will continue to be a key part of our COVID response, so we can understand how much COVID is in the community and what actions are necessary. And on that note, we will launch on-site testing for travelers arriving at the Stanfield International Airport by June the 14th, and there'll be more details on that in the days ahead. We're happy to be working with the Halifax International Airport Authority and Nova Scotia Health. And as I said, we will be sharing more details next week. Wave 3 has been difficult, and it's not over yet. But our phased plan will ensure we can reopen our province safely. And our approach will continue to be, as it has been for the last 14 to 15 months, a slow, steady, and cautious approach. Nova Scotia's reopening plan may look a little bit different than other provinces. And for starter, we have very deliberately chosen higher vaccine targets than many other provinces. It's important that we have a solid layer of protection from vaccine as we move through our phases. Our plan is built and based on meeting several important criteria. The first of which is our epidemiology. We'll continue to look at case numbers and trends of case rates, outbreaks, and signs of community spread. The second factors we look at is our capacities within our public health, within the lab and testing capacities to identify and manage cases. We also look at our healthcare capacity and the ability to manage and treat COVID-19 patients. And finally, we'll be looking at our vaccination rates. The higher the rate, the more and the faster we can open up. The plan that we're presenting today is based on our one-dose coverage of vaccine, and it is meant to get us through the summer. But one dose only gives us a certain level of protection, and we still need to take other precautions to have maximal protection from COVID-19 and its variants while we have one-dose coverage. So for the summer, that means continued testing and public health measures, and it means we can only relax restrictions a certain amount. Every phase will have incremental changes. And if COVID activity and all the other parameters I mentioned are within acceptable limits, we can move through the phases, hopefully every 2 to 4 weeks, and especially our vaccine, as I said earlier, if we're hitting our vaccine targets and our epi is fine, we should be able to move through things in 2-week phases. But we may need to go a little slower if necessary, and some of that is how fast we can build our vaccine coverage rates. But we can expect to have some level of restrictions all summer until we have 2-dose protection. And then in September, when we get at least 75% of Nova Scotians having 2 vaccine doses, things will shift again. Then it will be about living with COVID-19 and hopefully very limited restrictions and voluntary public health measures such as masking. But for now, let's focus on phase 1, which begins June 1st at 8 a.m. and will be in effect for at least 2 weeks. We are still concerned about COVID activity in HRM and CBRM, particularly in the Sydney area, so reopening will look a little different in those areas. The key differences in phase 1 for these two areas are schools and travel. Schools in HRM and the Sydney Academy family of schools will remain in at-home learning for phase 1. Exceptions will be made for students with high complex needs, and schools will be reaching out to those families early next week with additional details. All other schools in the province will reopen for in-person learning on June the 2nd. Schools have not been a significant source of COVID transmission, and the precautions that remain in place are effective and will allow students and teachers to return safely. I feel strongly about getting kids back to school, and we are fortunate that most students can finish the year in schools. We also want to continue to be cautious about travel in and out of both HRM and CBRM. So for now, in phase 1, we will ask for people to limit travel in and out of HRM and CBRM unless it is an absolute necessity. Necessary travel does include for school, work that cannot be done at home, healthcare, childcare, and other types of caregiving, child custody and other legal arrangements or requirements, attending a funeral or end-of-life visit, and providing or securing essential products or services. Testing, COVID testing and COVID vaccination appointments are considered essential, and so people can travel in and out of HRM and CBRM for those. And I know this is tough, especially for these areas, but we expect this will be short-term as long as case numbers continue to decline. We'll be watching the case numbers closely in the coming days and making some final decisions in these areas, potentially before June the 2nd. So let me move on, and here are some highlights of changes that are across the province taking effect on Wednesday. The outdoor gathering limit will be a consistent group of 10 and within which people do not have to maintain physical distancing. The indoor gathering limit does not change in phase 1. Nova Scotians can only gather indoors with their household, or if you're a household of 1 or 2, you can have 1 or 2 other people that you can get together with. Restaurants and licensed establishments can open outdoor patios with the necessary distancing between tables and a maximum of 10 people per table. And as we've had before, masks will continue to be required when not actively eating or drinking. All retail businesses will be able to open at 25% capacity with the ongoing public health measures around distancing, masking, and movement of customers, etc. Personal services like hair and nail salons can open, but for appointment only, following their existing sector plans. They will not, in phase 1, they will not be able to provide services that require the client to remove their face mask. Fitness gyms and studios can offer outdoor programs for groups of 10 with distancing. They can also offer one-on-one personal training indoors or multiple one-on-one groups in a gym if the distancing can be maintained. Sports, recreation, arts, and culture groups can resume practices and rehearsals outdoors with groups of 10 without distancing. And there can be multiple groups of 10 as long as there can be distance between each of the groups. But there will be no games, league play, or performances in phase 1. Professional artists, musicians, dancers, and actors will be able to start rehearsing indoors with up to 15 people as long as they have a COVID safety plan. People living in long-term care homes can visit with family outdoors and without distancing, which means a hug, if the resident has had 2 doses of vaccine. Residents who are fully vaccinated can also resume recreational activities on site, and participate in visits by specialized workers and volunteers like hairstylists and faith leaders. We are also encouraging those who cannot work from home to keep doing so during Phase 1. So these are just some of the Phase 1 measures. Our overall focus is on more outdoor activities and keeping groups small. We're able to move into Phase 1 because case levels, community spread, and outbreaks are now manageable, and we have testing and lab capacity. Hospital and ICU admissions are also starting to have stabilized and are starting to decrease. And our other marker is our vaccination rate. Our target for the full entire percentage of the population needing to be vaccinated with 1 dose for Phase 1 is 50%. And today we're at 53%. The vaccination target is 60% of the entire population having at least 1 dose of vaccine. And we're well on our way towards that. Wave 3 has hit us hard, but we acted quickly to reduce spread and keep Nova Scotians safe. The decisions the Premier and I make are not always popular, and they're certainly not easy. And while we are fortunate to have gotten things under control fairly quickly, we must remember the impacts of these variant strains. Too many lives have been lost, many are still in hospital, and many more have suffered financial and mental health impacts. The path we have taken throughout this pandemic has been up to us, and that still holds true. If we work together to keep our case numbers down and get both doses of vaccine, we can have a great summer together. So I wish everybody a safe weekend and enjoy the news of reopening. But please remember that the reopening starts June the 2nd, not this weekend, and it needs to be a steady and cautious journey. So just a modification. So we actually have two families, my apologies, two families of schools in the Sydney area that are staying for online learning. The Sydney Academy family of schools and the Riverview High School family of schools. So two families of schools in the Sydney area.
Great. We'll now take questions from media on the phones in the time we have allotted, starting with Jean Laroche with CBC. Jean, are you there?
I am. Thank you so much. My question is for Premier Rankin. When it comes to students with, as the province has identified them, highly complex needs, last Friday, you'll remember Dr. Strand said there was no public health reason they could not return to the classroom, yet your government refused to allow them to do so. In fact, this past Monday, you told a colleague of mine logistics was a problem and that you were going to help these families financially. This is clearly a different plan that you're announcing today. What changed since Monday to warrant this change in direction?
So we were facing increasing cases and very concerning hospitalization numbers when we decided to close schools for in-person learning across the whole province at that time. But this is a great place to be in now for our province. Our cases have come down significantly. I did say at that time that we would provide supports, and I reiterated that to your colleague that we are looking at a support program. I'm committed to providing supports. We looked at options to doing that outside of the classroom. So it would be outside. There would be support coming into families, and they would conduct that type of support system outside. But frankly, it wasn't as good as getting kids back into the classroom environment. Given the number of students that this would be impacted by, we can safely have them on buses and going to the schools and not have large classrooms full of schools in the Halifax area. We can do this in a safe way, and they'll get more one-on-one instruction from EPAs. So this is the best option, and this is the way that we're comfortable moving forward for Halifax and Sydney right now.
Jean, do you have a follow-up?
I do indeed. This one is for Dr. Strang. So best case scenario, we're talking about moving through the phases. I guess since there are 5 phases, not 4, we're talking about, 10 weeks at the best? And 4 to 5 months at the worst case scenario. Other harder hit provinces are moving much faster. Could you explain the reasoning behind this, what some would see as a very, very cautious approach?
So it really is 4 phases. The 5th phase, we want to make sure the 5th phase is when we get 2-dose coverage, which really is September. When we get there with 2 doses. So we're talking about 4 phases. The first one starts June the 2nd. If we hit our vaccine targets, which are everything we're showing, people are still showing up. So we still need everybody to come out and get vaccinated. And our epi remains where it is. We should be able to move through the phases in every 2 weeks. However, we need to make sure that people understand that if we need to go a little bit slower, that we'll take the time to do that to remain safe. So I fully anticipate, in all likelihood, we'll move through these 4 phases and get to that 4th phase, which is what the rest of the summer looks like, by around middle of July. That is a little slower than other provinces, but we didn't follow other provinces when we were opened after the first wave. We took a more slow, cautious approach, and if people remember back a year, that actually paid off for us. Other provinces had resurgences while they were trying to reopen it, where they still had lots of disease activity. I think we've learned in Nova Scotia that a slow, cautious approach actually works, and that doing that allows you to move forward. One of the things we've heard consistently through all our consultations is from all the business sectors, we do not want to lock down again. That would be the worst possible thing. So what we're doing is making sure we follow that to put us on the best path possible, keeping restrictions, slowly opening them up, building protection from vaccine, so we're not in a place where we'd ever have to consider having a lockdown again.
Next, we'll go to CTV and Natasha Pace.
Thank you. Sorry, I hit the wrong button. I'm just wondering, PEI and New Brunswick and other provinces have really clear dates, like June 27th, they want to open the Atlantic bubble, and August 3rd, they want to have the 3rd phase in. Why are we not seeing any dates? Everything we're seeing today is just strictly for phase 1. Can you just explain to people why there's not a more comprehensive plan with really key dates to look forward to?
So I think I just repeat the answer I just gave to Mr. LaRoche. We expect every 2 to 4 weeks. If things go well, every 2 weeks. But as I've said many times here, that this is about both an art and a science. We have to look at the data, look at the context around what everything is happening for us. It's wrong to lock ourselves into dates, because we don't know exactly what's going to happen when we open things up. We have to be open to the possibility that we have to certainly wait for 2 weeks to see the impact of every time we open up further. But you have to allow yourself the ability to say, we need to slow down a little bit because of what's happening. So I firmly believe that that putting dates out there creates unnecessary or expectations that we may not be able to meet. We need people to understand that this is a step-by-step process, that there needs to be caution and needs to be flexibility.
Natasha, do you have a follow-up?
I do, thank you. In regards to the airport testing, I know that the airport has been calling for that for some time. They proposed a plan in January. Can you expand a bit on what testing travelers at the airport will look like?
So as I said, we're working on the final details. We'll have much more to say in this next week.
Moving on, we'll go to Global and Alicia Dross. Go ahead, Alicia.
Thank you. I understand why you're not giving any dates for the next phases, and that's fine. But I'm just wondering if you can elaborate on maybe even what phase we might expect to say, open up to the Atlantic bubble, or even at some point at what phase we might expect to allow other Canadians from outside the Atlantic bubble into Nova Scotia.
Yeah, and some of this detail is in the infographic that we'll be making available. If things go well, we're like other Atlantic provinces, we're all looking at a target around Canada Day, where if things go well, we might be able to look at an Atlantic bubble. But there's a lot that has to happen and lots of discussion between now and then. And later on in the summer, perhaps once we get into August, maybe being able to look at, certainly as we open up to Atlantic, the bubble, also looking at, allowing many more travelers to come in, but still with a 14 14-day quarantine from outside Atlantic Canada. And then if things go well, we can start to look at how we may modify other Canadian travelers with proof of vaccination or testing, potentially, and being able to limit or remove the quarantine requirements. That's likely more into the area of beginning of August before we could do that.
Just to add to that, right now it's phase 3, and you'll see that that's available online. You'll see potential for Atlantic bubble opening, and that's based on vaccine status, border testing, and epidemiology of not only our provinces but the other provinces. So that's phase 3, which is each phase is 2 to 4 weeks. So doing the math, we could get to phase 3 within those the 4-week period between phase 2 and 3. And then phase 4 looks at beyond Atlantic Canada. And so we didn't come to a consensus on a date. PEI was 27th. New Brunswick was looking at the 1st at the time when we were talking with each other, the 4 premiers. But we continue to have those talks. We'll be talking again later in June. But this is all contingent on the success of our plan here and then the success that the other provinces have as well.
Go ahead with your follow-up, Alicia.
Thanks for that. And can you just provide, I don't have that infographic that you're talking about in front of me, but I'm just wondering if you can provide maybe some details on what we're hoping to achieve vaccination-wise before we get to each phase.
So as I said, our target for phase 1 is we've already hit that, 50%. Phase 2 is 60%. Phase 3 is 70%, and then phase 4 would be the 85%. And that is based on, that's the percentage of the population that has 1 or more doses of vaccine.
Moving on, we'll go to Michael McDonald with the Canadian Press. Go ahead, Michael. Michael, are you there? We'll come back to Michael. Moving on to All Nova Scotia and Lindsay Armstrong.
Hi there, Premier. First off, I'd like to learn a little bit more about this infographic you mentioned. At this stage, it does not look like we have any clear sense of what phase 2, 3, 4, or 5 will look like. Comparing to what we've seen from our neighboring provinces, when will we see sort of a full phased plan that actually tells us what we can expect going forward beyond the next 2 weeks after June 2nd?
So if it's not online now, it will be momentarily at novascotia.ca coronavirus reopening plan. There is a plan with a list for each phase. We went through some of the high-level areas, and it is 2 to 4 weeks after each phase. That's an approximate timeline where we see some of the milestones being reached. So again, Dr. Strang went over some of the vaccination targets that we're looking at. So we're hoping Nova Scotians continue to come out in large numbers to achieve those numbers. But we also look at a number of other factors, like I said, the COVID case counts, the hospitalizations. So we'll continue to go through each phase. It's all available online. And we'll continue to make our decisions within those approximate timelines, but we're not tied to dates.
Go ahead with your follow-up, Lindsay.
Thank you. Given that, as far as I know, no one has seen that plan that you're describing, and it's hard to base any questions on what that reopening will look like. I'm wondering if Premier, you will commit to holding off on calling an election until we've reached phase 5 of this plan.
I'm not thinking about an election today. We just got through a difficult month of May, and that's been my sole focus. And we actually, today is the 1 month period. We locked down province-wide April 28th. I'm very proud of Nova Scotians for doing the work to get us to where we are today, to be able to be in this place where we're able to look at a reopening strategy. I continue to focus on public safety. That's my sole focus right now.
We'll circle back to Canadian Press. Michael McDonald, are you there? Okay, moving on, we'll go to Radio Canada, Adrian Blanc.
Good afternoon. And Dr. Strang, are we talking about bubbles when we talk about gathering up to 10 people with the same people outside and 2 households indoors?
No, it's not. We're not using like a two bubble, just only people between two households. What we're saying is people can get together outdoors with people from outside of their household, up to 10 people. But what we're also asking that people should be careful about the number of times they're doing that, and when they are getting these groups together, as much as possible, make them consistent with the same people. One of the principles around minimizing the spread of COVID is reducing the number of people we have close contact with. So if you think about it, we're now allowing people to start to reopen their social lives, but thinking carefully about the number of people then that you introduce, and so keeping your close social circle of up to 10 consistent is really important.
Adrian, do you have a follow-up?
Yes, Dr. Strang, out of curiosity, I would like to know why phase 1 starts on Wednesday only.
And that's simply we're getting a time for announcing it today and people to make the necessary adjustment as part of our business, our consultations. Many businesses and other sectors say they need a few days to start to prepare. And so Wednesday gives us that space. It also gives the schools an opportunity to get prepared to receive whatever students are having coming back for in-school learning.
Moving on, we'll go to the examiner and Tim Bousquet. Go ahead, Tim.
Hi, thank you. I'm not sure who I'm asking this to, but is there a contradiction? I keep hearing that it's important to open schools, but we're not going to open schools in HRM. But apparently, I can go to a patio and drink beer. Is there a contradiction there?
So Halifax is in a very different position, I think you would agree, Tim, than other parts of rural Nova Scotia that have literally, some of them, no cases, active cases right now. We're taking a very cautious approach. We do have known spread still in the Halifax area and some in Sydney, so we're watching that very closely. We could make some changes there, but it's also really clear that outside has very, very limited risk for transmission of this virus. So we're comfortable province-wide for outside activity and very limited activity inside and retail down to 25%. We're getting there. We're starting to reopen slowly, but it is important in areas of the province where there is very low risk of contracting COVID that we open our schools.
Go ahead with your follow-up, Tim.
Can you speak to the airport? I'm not understanding, or the test, I believe I've heard you say in-flight tests, so the flights will be given on the plane, and why hasn't this been implemented, frankly, months ago?
So we've been working with the Halifax Airport for a number of several months on this. Everybody seems to think that it's really easy to just do testing at the airport and do it tomorrow. It's actually not. It's very complex in terms of making sure you don't impact the flow of people through the airport, the logistics around getting testing that gives you accurate information. So we've been working through all of those issues. It's not testing in flight, it's testing at the airport. It's also important to remember that it's not like we haven't been doing testing of travelers coming into the province. We've just been testing them through other methods, mostly getting them to go to our PACs. We're just now adding on the ability to test people at the airport when they arrive, and so we'll be saying more in details how that's happening in the next week.
Next, we'll go to Victoria Walton with the Coast. Go ahead, Victoria.
Thanks. I'm wondering about the restaurant patio requirement, whether any restrictions will be eased for restaurants that don't currently have a patio, if it'll be easier for them to apply to open one this summer, and also for patios that don't have payment machines outside, things like that. Will customers be able to go in to make payments or to use the washroom, things like that?
So we're starting with outside because, again, that's lower risk levels. Keep in mind that we had the shutdown extended to June 9th. This is good news that they're able to open up earlier than expected, a full week, if they have a patio. They'll be able to use facilities and make payments, but we're not at the point yet where we're public health's not comfortable yet with indoor dining. That's the next phase. So we're able to get there potentially in a couple of weeks, but we want to make sure we're taking this cautious approach. That's how we've done it all along as we start to open up. But clearly, outside transmission is much lower risk, and that aligns with allowing the 10 people to start to gather with no social distancing outside and not inside.
Go ahead with your follow-up, Victoria.
Okay, thanks. That didn't fully answer my question about whether, patrons can go in if they need to make a payment or use the washroom or things like that.
Yeah, well, they're going to need, it's same as if there was another type of business like retail. If you have to make your payment inside, then that's accommodated.
Moving on, we'll go to CBC, Shayna Luck.
Hi there. You're allowing non-essential travel between some areas. From my read of it, that's starting now. But people may want to visit each other, and if I'm reading this right, they're not allowed to do that until June 2nd. So I could foresee some people saying, hey, I'm going to leave my community, see my family this weekend. Can they do that?
The ministerial directive, which it requires people to travel only within their municipality, except for certain types of essential travel, is in effect until June the 1st.
Go ahead with your follow-up, Shayna.
Okay, thank you for that. And the news release says it talks about the passenger testing program at the Halifax airport. What about at the land border? Will testing be used there too?
We're looking at that. It's much more logistically challenging about how you would potentially incorporate testing at a border when and not create significant safety issues with and creating challenges around the flow of traffic. So we're looking at that, but it may well be that we are, again, I come back to the point, it's not that we're not testing travelers at all. We use other methods of testing, and it may be that we continue to use those methods of testing for people who come across the land border.
Next, we'll go to Global and Jesse Thomas. Go ahead, Jesse.
Thank you very much. Many of the questions have been asked. I'm just curious why we didn't start this briefing with that infographic giving, solid answers. Can anyone tell me when that information is going to go up?
Yeah, sorry to everyone that doesn't have a copy of that. I understood that that would be disseminated, so apologies that you didn't have that at the start of the briefing. We'll make sure that you get that right away.
Do you have a follow-up, Jesse? I'll take that as a no.
No, I don't think so.
Okay. Moving on to Radio Canada, Maude Montembeau. Maude, are you there?
Hi, bonjour, yes. Can you be more clear about when the rest of the Canadians will be allowed to come in Nova Scotia without a quarantine best case scenario?
So that I think we're looking at probably the best case scenario when we could start to remove the quarantine requirement for individuals based on a combination of proof of vaccination status and some testing is likely. The best case scenario would be like August, beginning of August.
Maude, do you have a follow-up?
And how about the other citizens of the Atlantic bubble? Again, a best case scenario without quarantine.
I think, as we've talked about, the Premier and I have just already answered some questions around, everybody around probably the end of June, early July, but there's lots of things that have to be, there's a whole month and lots of discussions that have to happen between provinces as well around making sure we're aligning and consistent in a number of areas.
I'll do one final check-in with Canadian Press. Is there anyone there for Canadian Press? And I've received a note that the PDF is now up online of the infographic. So that's all the time we have for questions for today. Back to you, Premier.
Yeah, and again, apologies that you didn't have that PDF. If there's questions, please send them in, and Dr. Strang and I will get those answers to you. So today I'm wearing the Annapolis Valley tartan, and under better conditions, this would be the kickoff to the Apple Blossom Weekend. That's an annual celebration of agriculture and tradition, but this is the second year in a row that the Apple Blossom has been canceled because of COVID. The festival committee has asked that I show some blossom pride virtually, and I want to thank the local member of Parliament, Cody Blois, for gifting me a tie to wear today for that. where we were, think of where we were a month ago, literally April 28th, when we shut down the province. Daily cases in triple digits and climbing, hospitalizations at a critical level. But when we shut down, you stepped up. You did the hard work, you followed the protocols and the restrictions, even when they seemed harsh. You closed your businesses, you embraced at-home learning with your kids, and I know that it hasn't been easy. You stayed away from family members and stayed close to home. These are not small sacrifices. These are major sacrifices. And because you did that, we are now in a position to consider a summer that is a little more open, a little more social, and still safe. Today's reopening plan includes COVID. The virus and its variants are still here. We can't forget that. These phases are very cautious, data-driven approach to bringing businesses back and reuniting families. Our success will depend on a number of variables. It is in all of our hands collectively to achieve these milestones. We have to continue to test. That is the best way to track COVID and slow the spread. We have to continue to get vaccinated. And I'm so proud of all of you for doing your part and getting the shot. We have to continue to follow these age-old protocols, wearing your mask, keeping your distance, and washing your hands. And we have to follow the restrictions that are still in place for each one of these phases of the reopening. We can do this. We've done it before. Thanks and have a great weekend.